Doctor, did you say on direct examination that you performed an operation? Yes, I did. What kind of operation was it? It was an inguinal hernia operation. And is that a tension-free hernia repair? Is that what you are referring to? That is correct. An inguinal hernia varies in size, does it, doctor? Yes, it does. It depends on the bulge, which can be from 1 centimeter in distance to a large mass that extends down as far as the knees. Doctor, is there a bulge or a bulge of an inguinal hernia? Yes, there is. What does that bulge contain? It contains a sac. What is that sac made of? It is made of peritoneal membrane that lines the abdominal cavity. And plus, doctor, is it not true that one or more loops of small intestine or a piece of fatty membrane or omentum that is attached to the outside of the small intestines? Just a moment. You are going on and you are testifying. I am the one who is testifying here. I am sorry, doctor, excuse me. I was about to say that a herniorrhaphy involves replacing the hernia. Doctor, replacing it with what? Replacing it with contents in their correct anatomical position. And then it requires what, doctor? It requires a repairing of the weakness through which they protruded so the hernia does not recur. Doctor, is it true that as the hernia may not be obvious once you are lying down, the surgeon usually marks the site of the hernia? Yes, he does. With what, doctor? With a pen. And before the operation that takes place? Right. Is it, doctor, a bilateral hernia which can be repaired? Yes, it can be repaired at the same time or as 2 separate procedures. Doctor, the traditional hernia repairs merely pushed the intestines back into place. Is that not true? Well, it then was stitched together, that is, the 2 sides of the gap through which the hernia formed. And, doctor, these stitches were placed under tension like a darn to hold the wound together. This approach often caused persistent discomfort and an estimated 20% chance of the hernia recurring. Doctor, nowadays most inguinal hernias are repaired using an open space? Yes, as well as a tension-free reinforcement in which a piece of sterile, non-absorbable polypropylene mesh is placed over the inguinal canal. And what is the purpose of that, doctor? It is to cover the hernia opening. Doctor, does this prosthesis encourage strong fibrous union? Yes, it does. This prosthesis encourages strong fibrous tissue to grow around and through the mesh. Doctor, this quickly develops into what? It develops into a strong, tension-free reinforcement which, because it is inside the abdominal wall, means the hernia is less likely to recur. Doctor, the standard procedure for repairing an inguinal hernia is what? Well, it involves an open anterior approach. Laparoscopic repair is becoming more popular for young, otherwise fit adults as it allows a more rapid recovery and return to work. If performed, doctor, under local anesthesia, the surgeon injects local anesthetic, does he not? Yes, he does. And what is the anesthetic? It is epinephrine, which constricts blood vessels to reduce bleeding. And is that, doctor, along the line of the proposed incision? It is. Doctor, a small needle is used, is it not? Yes, it is. Why is it used? It is used to numb the skin. Then a larger needle is used to inject local anesthetic more deeply to block the nerve supplying the inguinal canal region. Doctor, half the anesthetic is reserved, is it not? Yes, it is. Why is it reserved? It is reserved to inject around the neck of the peritoneal sac containing the hernia. And doctor, any other sensitive areas? Yes. Doctor, sedation is often used too, so you remember little of the procedure afterward. Is that not correct? That is absolutely correct. And an incision is made within a skin crease? Yes, usually starting a finger's breadth above the pubic bone. Doctor, the incision is around 2.4 inches or 6 centimeters long and extends 2/3 of the way up to the hip bone. That is right. The surgeon cuts through the underlying tissue, sealing and cutting any large veins while taking care not to cut into any intestines within the hernia. Get it?
Yeah, I think I got it.
I read it.